The St. Paul EMS Academy is a chance for at-risk, minority, and women students of the St. Paul area to pursue meaningful careers as EMTs. The goal of the program is to create a medical workforce in St. Paul that is reflective of the diverse communities of the city. Studies showed that there was only about one EMT of color in the state of Minnesota completing the EMT basic course every year. So the St. Paul Fire Department approached the Human Rights Department and proposed a way to create a pipeline for more diverse applicants to the St. Paul Fire program. What would have normally taken 30 years with the status quo for providing women and minority EMTs for the St. Paul Emergency Medical Services workforce, we did in just 1 year.
It's good that the public services within the city reflect the population, and St. Paul clearly is a very diverse community. So by helping to promote diversity within fire and EMS, we're doing a good job overall for the city of St. Paul.
I came from a family that doesn't have a lot of money, and when I was in high school, I thought that I was just going to get a job, maybe working in retail or fast food, and I was going to stay there for the rest of my life. And since this program, I know I'm not going to be working a dead-end job. My future, I know, is bright, and I know that good things will come to me.
It's been a life changer for him. It's amazing to see the leadership that's grown, the self-confidence. Just watching that grow is incredible.
The goal of the St. Paul EMS Academy is to break the cycle of poverty for our applicants. So many of the students who start the EMS Academy are unemployed or in very low-income jobs.
At the beginning of the project, people told me, "Why are you doing this?" And they said, "You're going to wreck your pass rate. They might shut your doors down." And I said, "Really? Is it just that the color of their skin or the fact that they're ethnically diverse, does that scare you that somehow they won't succeed at the test?" Well, we have over 95% success rate on first attempt at the National Registry test. So they get the same training, which is really world-class training, than we would give at the college. And they have to pass the same tests.
As far as the quality of the EMTs that are coming out of this program, I've been a nurse for 20 years, and if I needed to call 911, I'd be very comfortable with them responding to my call.
One of the biggest challenges the Academy used to face was finding jobs for the graduates after they completed their EMT training. So the Phase 2 ambulance service solves that. We are able to recruit students directly after graduation, get them field experience they will need to either A, pursue a career as a paramedic, or B, work as a EMT at one of the local hospitals or ambulance services.
We have a lot of patients in St. Paul who are Hmong. So with me being Hmong, I was able to communicate, explain to them what we're doing, why we're doing it, and they were able to be more comfortable with it, understand what we're doing, and they allow me to take care of them.
Even though they might be suffering from a disease, I know that when I get in my ambulance, I can make them happy for just a little bit of time, and that's the most rewarding part of this job.
In that 20-30 minutes, they just want to talk to you, to somebody. Yeah. So we work in this field, talking with them, trying to make them smile. It's really nice.
It's way more comforting to have someone come into your home who looks like you, thinks like you, talks like you, than someone who's never even, spoken, heard your language before, heard of your language before.
Having providers who are not only medically trained, but also come from the same areas of the city, the same cultural backgrounds as our patients, help the EMS Academy providers to relate to the challenges that our patients have in their day-to-day lives. And I think that's been a tremendous benefit to the patients. And that's something that we have not seen when we've worked with other EMS providers in the city.
What the city of St. Paul and Minskill actually see as value to this is that we are connecting our young people of color and women to critical healthcare professions that we see as necessary for the success and health of our entire community.
One of our participants in one of the graduations said, "I've attended more funerals than graduations." So it is both a project for social change, but it's a personal project for each one of them to improve themselves and improve the profession. And I think we're breaking a lot of barriers.